The first thing to say on that is that there is not one particular type of breast cancer. There's probably at least 27. And they do behave differently from each other. Some of them are sensitive to estrogen hormones. Some have what are called HER2 receptors. Some grow very, very slowly and spread slowly. Others grow very quickly and spread very quickly. So each of them has to be managed according to how much of a cancer burden there is in the body and whether that cancer burden has gone outside of the breast into lymph nodes or even to somewhere else. Now, the size of the tumor is clearly very important. How rapidly the cells are expanding and growing is important, and that's reflected in something that the pathologist sees down the microscope called grade. And grade is not to be conflicted with stage. Stage is how far the extent of the cancer has gone, whereas grade is how quickly the cancer is growing. So the size of the tumor, whether or not they're sensitive to hormones, and that is whether they have hormone receptors, including HER2, the grade of the tumor, how quickly the tumor cells are growing, the proliferative index as well. And we also look at the presence or absence of lymph node involvement, and of course, whether or not there's any seedlings from the cancer in another part of the body. All those things are put into a statement of stage, which you will see if you look at a surgical oncologist's summary or an oncologist's summary. And particularly the common one used is the TNM stage. So T is the tumor size, N is the lymph node status, M is whether or not there is any distant disease. Quite self-evidently, the lower the stage and the lower the grade, the higher the risk of a cure from the cancer from treatment. The commonest treatment for most women diagnosed with breast cancer still is surgery. Now, we hear a lot about other treatments. We hear a lot about radiotherapy, about chemotherapy, monoclonal antibody therapy, hormonal therapy. But so far, none of those has actually replaced surgery as the most beneficial single treatment. So for most women, surgery is central to it. Now, sometimes the adjuvant therapy is given before surgery, sometimes afterwards. And if it's given before surgery, it's called neoadjuvant therapy. So somebody might have a course of chemotherapy and trastuzumab, for example, 6 months before they actually undergo surgery to try and downstage the tumor to make it smaller. Surgery has changed massively in the last 20 years. It used to be pretty basic, unpleasant surgery. And when I trained as a medical student and junior doctor, it was not good. But I'm happy to say that over the last 15 years, particularly, the cosmetic side of breast surgery has merged with the cancer side of breast surgery. And a fully trained person or persons should be able not only to remove the cancer, but to do as required total or partial breast reconstruction. And if they're not needing any reconstruction, at least to do a wide excision, a lumpectomy in a very aesthetically sensitive way, hiding scars and making the shape of the breast look natural and look normal. So the surgery has progressed hugely. Obviously, reconstructing the breast, if the breast is lost for a mastectomy, has come on in a tremendously sophisticated way over the last 20 years. And I think people should be reassured that it isn't the operation that their grandma had 40 years ago. If a patient has surgery first, then the tissue removed is fully analysed by the pathologist. They are discussed in a multidisciplinary team, which comprises not only the surgeon, but the radiologist, the pathologist, the oncologist, the radiation oncologist, the breast specialist nurses, and the totality of the patient is considered for what their best adjuvant treatment and their best follow-up will be. Typically, if all the treatment envelope has been finished, then they will be seen once a year in the clinic for several years, and then once every couple of years for several years after that. They will be offered, assuming there is residual breast tissue, if it's breast conservation, for example, or if there's a natural breast on the other side, they will be offered regular screening with mammograms and occasionally with MRI scans. And my practice is to see people in clinic for up to 10 years after their original management. Obviously, the second half of that, they're seen much less frequently. But the highest risk period is in the first 3 to 5 years after surgery. Now, the practice of the NHS now is typically to discharge patients fairly early. I think the longest that the NHS clinics will follow somebody up is 5 years. My personal view is that's too short. I think patients do like the reassurance of being seen after a treatment like this, even though most of them find it quite anxiety producing to go to clinic once a year or once every 2 years. This is an interesting question, and a lot of research has been done on this. It always worries me slightly when a patient comes along and they've got something that they have found online or a friend has referred them, which is actually really difficult to do and sometimes includes paying a lot of money to a place or a person. And unfortunately, there are a lot of so-called therapies out there which are not only ineffective, but they're also expensive and they're also dangerous. And I've had patients harmed by going and having treatments such as whole body warming, for example, which is completely non-researched and non-scientific and is actually quite dangerous. There are simple things that can be done which make a really positive impact on recovery and remaining disease-free. And regular exercise, definitely keeping weight down, keeping a BMI, if possible, between 20 to 28 and not going more than that. And reducing or completely cutting out alcohol. If you want to look at dietary things, there are a lot of people who go more and more into less red meat, so more a vegetarian, fresh fruit and vegetables, and that probably does have some benefit. Certainly less fatty meats regularly does have some benefit as well. There was a book published a few years ago by an excellent colleague called Michelle Harvey, Harvie, and she put together at that time, it's at least 12 years ago now, all the scientific evidence for fairly simple lifestyle adaptations that can make a difference. And I would advise anybody to look up Michelle Harvie on the internet, because all that will have been updated. And although there hasn't been a second book, Michelle has written a lot of scientific papers on this. Be wary of people who say you have to cut out all of dairy, because you do need calcium, you do need vitamin D as well in order to keep your bones strong and keep your body systems working properly. But the basic things are exercise, weight, alcohol. Those are the three main things. And then maybe some lifestyle dietary changes, moving more towards fresh fruit and vegetables, less red meat, and less processed foods. Less processed foods, because processed foods have often got a lot of saturated fats in as well as flavorings. Broadly, it means that the patient doesn't get breast cancer again. There isn't a recurrence. They don't have to carry on with further treatment schedules. And in the scientific literature, it's defined as 10 years disease-free survival. That's what success is defined as. And obviously, what you want if you've had cancer is never to have it again. And that's the ideal situation for the patient diagnosed with primary cancer. For the patient who has stage 4 or metastatic breast cancer, then successful treatment is being able to live as normal life as possible with the diagnosis, knowing that the diagnosis will never actually be cured, but to have a treatment regime that allows, as far as possible, day-to-day normal living activities, enjoyment of life, pain-free, and good eating and good relationships. Those are the things that matter. A lot has been in the media recently about hormone replacement therapy after breast cancer, about lifestyle changes, which all make living so much easier having had a diagnosis of breast cancer. So there are two things. Primary breast cancer, it's 10-year disease-free survival without a recurrence. For somebody who's got a situation where they can't be said to be cured, it's giving a treatment that allows them to live the most high quality of life with the disease kept in abeyance. And that's also a success.